I have some breaking news that I have to share with you today. This is very important, so listen up. If you have Medicare, we know what the 2026 Part B premium is anticipated to be. And the projection almost always works out to the dollar because it's all in the math. And so here's what the math says. It says that the Part B premium is going to increase the most we have ever seen in 2026. Currently in 2025, it is $185. And that is the standard premium for people with Medicare Part B. But in 2026, it is projected to increase to $206.50. That's a $21.50 increase for 2026. So in this video, I'm going to talk about what's happening, how we know this, and also tell you 3 ways that you could potentially save money on your Medicare Part B and hopefully reduce the amount of increase that you're going to have in your Medicare Part B. But for most people, the projected increase is $21.50, going from $185 to $206.50 in 2026. While I'm not celebrating that, yes, I am celebrating my 50th birthday, and my team, as you can see, is crazy and very fun. So here it is. My 50th birthday. So let's talk about this increase to Medicare Part B. The baseline premium of $185 in 2025 is what most people paid. Now, some people paid more and some people paid less. And the more that you paid was based on your income. If you had higher income, you paid more. If you had lower income, you paid less. If you had very low income and living on a very tight fixed budget, then you maybe paid zero. For those people, nothing would be changing. But for everyone else, big increases. Now, this is from the 2025 Medicare Trustee Report. And the Medicare Trustee Report is what Centers for Medicare and Medicaid Services uses to determine how much money is needed for the next year in order to cover all of the costs of Medicare Part B. So why is it increasing? Well, it's increasing because the cost of healthcare is increasing. It's increasing because the cost of services are increasing. So a lot of people look at this insurance and they say, that's what Medicare is, it's insurance, and say, oh my goodness, insurance is ridiculous. Why is insurance so expensive? And they're saying the wrong thing. It's not that insurance is expensive. Insurance is just an aggregate of cost. It's that the costs are expensive. It's just the doctors are expensive. It's just the hospitals are expensive. It's that the procedures and the medications and the cost of machinery are expensive. Have you ever, of course you haven't, but have you ever tried to go out and buy a CT machine or an MRI machine? There is an incredible amount of technology in this device I have in my hand. And I can buy this device for $1,000. You take this same technology and you offer it to a doctor, you can raise the price to $100,000 because of the money that flows in Medicare. Not Medicare, but in healthcare. So I'm getting on a little bit of a soapbox here. But the issue, oftentimes people point at insurance and insurance companies. Insurance companies are capped, by the way. The most that they can make is 15%. There is hardly an industry in the world with that thin of a margin. So what I'm saying is that the cost of care is driving this, and the cost of care is going up. So we're talking about doctor's visits. We're talking about outpatient surgeries. We're talking about MRIs and CT scans and the cost of treating chemotherapy and all of the medications and things that fall under Medicare Part B. All of those things have to be covered. And so that raises the price for everyone. And so they take and they say, how much do we need in order to offer Medicare for everyone? Remember that when you were working, you paid for Medicare Part A out of your taxes. When you were paying taxes there was a line item that you looked at every week, and when you received, or every few weeks when you received your paycheck, it said, oh my gosh, why am I paying so much to the government? It said, taxes, and it said Medicare, Social Security, right? So the Medicare you were paying for while you were working was Medicare Part A. The Medicare that you're paying for in your Medicare Part B premium is Medicare Part B. A was for hospitals, B is for doctors. So this increase to $206.50 is to get that 80% coverage for doctors. So why is it going up? Well, higher usage. We have seen this since COVID ended. There's been higher usage, and it hasn't gone down. So a lot of people thought there was this COVID bubble of people that needed services and that it would pass, but it hasn't. So usage has increased. I believe that the reason is that that we are less healthy. People are more unhealthy today than they have ever been in the history of this country, and so usage is going up. If you want to do something to lower the cost of Medicare, then take good care of your own health, right? That is what's driving costs, is that healthcare services are going up. Also, there is a rising cost in physician-administered drug spending. Physician-administered drugs means things like chemotherapy and other drugs that are administered by a physician, by a doctor. So when you're in a doctor's office and the doctor administers medication, that falls under Medicare Part B. That does not go under your drug plan, Part D. So some drugs are under Medicare Part B, and those costs have been increasing. And then there's just general trends of more volume, more usage happening in Medicare. So these things are driving the cost of Medicare up. So let's talk about who pays what in 2026. Well, if you are low income, on a fixed low income, there are special programs for you that will help you to cover the cost of Medicare Part B. And perhaps you're watching this and you already have access to that. But on a low fixed income, you will pay as low as $0 for your Medicare Part B. For the average income, you're going to pay $206.50. At least it's projected that you would pay $206.50. That is most people that fall under a fixed income in retirement. Now, in 2025, the limit for a higher Medicare Part B premium was $106,000 for an individual or $212,000 for a married couple filing jointly. Now, that was what we call the IRMA threshold. IRMA, the income-related monthly adjustment amount, which means the amount more that you pay for Medicare Part B, because Medicare Part B does not cost $185 in 2025. It costs much more than that. It costs over $600 a person. Why are most people paying $185? Because the government is subsidizing Medicare. It's extremely subsidizing Medicare. So when you make more money, it's not that you're being penalized to pay higher than everyone else as a penalty. It's that you are receiving less help from the government. You're actually just paying the full Medicare Part B premium. You know, with government, that's kind of how it works. Like we start out with a program where like, oh, everyone will pay their way. And it doesn't ever work that way. Like with Obamacare, eventually the government subsidizes all of it. And so it's kind of like the foot in the door. The government puts its foot in the door and eventually it takes it all over. That's kind of what's happened with Medicare. You know, the real Medicare Part B premium is $626. Don't quote me on that, but it's like $626 per person in 2025. I should have the real numbers for you. My team maybe will put the real ones on the screen. In 2025, everyone's paying $185 for the most part. Only people with high incomes are paying the real premium, and the government is subsidizing the rest. In 2026, the same thing will continue. We don't know if $106,000 for an individual person or $212,000 for a married couple is the mark. That threshold will probably go up a little bit. Maybe it'll be $110,000 for a single person and $220,000 for a married couple. It goes up every year a little bit. We don't get that threshold until in the fall. So sometime around October, November, we'll know what that will be. Now, that is a 2-year look back. They're not looking at how much money you made this year. They're looking at how much money you made 2 years ago. So the money that you made in 2024 is what will decide what your Medicare Part B premium is in 2026. Keep that in mind. All right, now what about your Social Security? There is a forecast for Social Security that it will go up 2.6 to 2.7% for 2026. For example, if you have a $2,000 benefit, then that would be about $54. That would cover the cost of your Medicare Part B premium going up. Now, there's this interesting rule about Medicare Part B premiums. They cannot increase more than your Social Security increases. So if your Social Security doesn't go up, your Medicare Part B premium is not allowed to go up. The Medicare Part B premium, it can take all of your Social Security gains, but it can't make you go negative. So let's say, for example, you're getting $1,000 a month and your increase was only going to be let's say it was going to be $20, but your Part B premium increase was supposed to be $26. Well, in a case like that, your Part B premium is not allowed to go up $26. It can only go up as much as your Social Security increase. On an aggregate, it's not perfect for everybody, but that's kind of the rule. So if Social Security doesn't increase with their cost of living increase, or COLA, C-O-L-A, cost of living increase, if that isn't greater than the Medicare Part B increase, then the Medicare Part B can increase the amount that they're supposed to. We've seen this happen in the past. And you think, oh, yay, that's great. Then I won't have a Medicare Part B increase. But here's what happens. On the books, it's still increased. They just don't charge you for it. So then the next year, we saw this happen a few years ago, I think it was about 2018 or something, 2019. We saw that the Medicare Part B premium went up, but the cost of living didn't go up. Cost of living increase didn't happen. And so the next year, there was a big Social Security increase, and the whole thing was eaten up by the Medicare Part B premium increase, because once the cost of living increase goes up, they take it all for the Medicare increase. It's still happening in the background. It's not going to take effect until the cost of living increase happens. I hope that makes sense. But that's what we call the hold harmless. It says that Medicare Part B cannot increase so much that it takes away all of your cost of living increase for Social Security. That's what we know for 2026, $206.50. What can you do? Here are 3 things that you can do. Number 1, look at your modified adjusted gross income, MAGI, on your tax return for 2024. If it was lower than $106,000 for one person or $212 for a married couple, you know you're fine. If it was higher than that, is there an opportunity to adjust anything in your taxes for 2024? I don't know. I mean, it's 2025 right now. Some of you maybe file an extension or something. If you're one of those people that's making a lot of money, then you want to consider your RMDs, your minimum distributions that you had to take. Did you have a major taxable event like selling a house or selling a business or something like that? Are there things that you can do to have timing in how you pay your taxes on those events to adjust your income? For some people, there is. Step number 2, if your income is a little bit high from an event, like selling a home or something like that, because many people, they get caught in this trap. They're not wealthy. They just have a home that they bought in 1970, and they sold it in 2024, and they earned a lot of money from that sale because the house appreciated. They're not wealthy people. They're just average, middle-class people who had a big event. Well, for you, there's the SSA 44. And the SSA 44 is proof of retirement income change. It says, hey, I made this money before, and I'm not going to make it in retirement. I had this event, and I'm not going to have it again. You may be able to get an exception to the IRMA rules. So work on that. Maybe file for an exception. Try to make sure that that if it's a one-time event, you're not going to be paying for a higher Part B premium because of a one-time thing, or because when your retirement income changed. Number 3, look at your coverage. This won't change your Medicare Part B premium, but in some cases it can. And consider, do you have the right coverage? And I'm talking about looking during annual election period from October 15th to December 7th is the main time to check, but there are other times as well. Sometimes people qualify right now for special enrollment periods because they have changes that have happened in their lives. At that time, you need to consider, or even now, are you on the right Medicare Advantage plan? Or should you be with the Medicare Supplement with a prescription drug plan? Or should you leave your Medicare Supplement and prescription drug plan and consider a lower cost Medicare Advantage plan? There are Medicare Advantage plans that pay your Medicare Part B premium for you in some places. They're not available everywhere. And in many cases, they're not a good fit because sometimes they don't have all the other coverages you need, like drug coverage. But sometimes they are a good fit, especially if you're healthy and what have you. So consider your coverage. Is there coverage that can help you to save money or even help pay for your Medicare Part B premium? I want to remind you that CMS will give us the final numbers around October or November, and after that, we will give you a full update. But that's what you need to know today. Please like this video, follow our channel. I'm giving updates like this all the time and keeping you aware of the things that are happening in Medicare, and I do it in a no BS way, giving you the truth, giving you honest information, comparing the different options without bias. Here at PlanFit, our agents aren't even paid commissions. There's 2 major things you need to know about us that makes us completely different from everything that I know that exists out there, everything. And number 1, our agents are not paid commissions. That's a big deal because there's no incentive for them to push you in one direction or another. We did that intentionally. They don't have to worry about their own health care. We have health care for them. They have their own health insurance here. They don't have to worry about whether they're going to pay their bills this month. They're paid a salary, right? So that's a really, really important distinction from anything else I know that exists out there. And here's the second really big one. We look at every option that's available to you and show you everything. Our agents are not paid commissions. They will tell you about everything available to you, and they don't have to decide based on their wallets and their pocket what to recommend to you. So those are the 2 things you need to know about PlanFit that make us completely different from everything out there. Agents are not commissioned, and they will tell you about every plan, even the ones that don't pay commission, because they don't have to think about that. Follow us, watch our videos, and we'll share some videos here that you should watch next.